Hey everybody, welcome back. This is Nurse Eunice, and in tonight's video, we have Wednesday Night Live, our CNA and PCT practice test. And I already see some of you all in the comment area. So, hello, I hope that you're having a wonderful day, and we will get started shortly. Right. So there is absolutely no reason. When I tell you no reason to fail the CNA or the PCT test, as long as you are in connection with Nurse Eunice, and I know some of you all are on your second or your third times, I'm going to ask first that you have you even read your book? I need for you to go back and consult your instructor because by the time you come to me, I'm your online instructor. There may be some other issues. It could be language barriers. So I'm going to ask that you do first things first, that you go to your local instructor first and get some pointers and some tips and make sure that you learn medical terminology. We have so many free videos, so many free assets and resources for you to learn medical terminology, but you will not be able to pass the written test if you don't understand what the words mean. So get some flashcards, go to our website, nurseeunice.com, and that is going to help you pass this written test. You can listen all day long, but you have to know it. So, how do you get our free study guides, our free vital sign checklist, etc.? You're going to go to nurseeunice.com. It's shown right there on the screen, and those downloads are great for CNA and nursing students. We have even some CPR, ACLS guides if you are an advanced healthcare professional. If you need something more advanced like ACLS and EKG, we have that on the site. And so I want you to learn this information. I want you to know it because doing so helps save lives. And I see Mila, you take your CNA exam in 2 weeks or so. I'm so proud of you. It's so many people saying hello. So hello, everybody. Oh, Dadu, that is so sad that she's not opening in one after graduation. So this is what I'm going to ask you to do. What I'm going to ask you to do is I need for you to send us your scores. I'm going to put the email address. You're going to send us your test results because your test results will tell you the areas that you need to focus on. And I do apologize that your professor isn't open, after graduation. And some places are like that. But you have to send us your test scores. Otherwise, I'm just giving you some information that won't be specific to your needs. So use that email address and send us your test results. Tomorrow we're going to be busy, but we'll try to get the information back to you by Friday. All right, everybody, question number one. Which chronic illness often requires daily dietary restrictions related to fluid intake, excuse me? Is it going to be A, chronic obstructive pulmonary disease or COPD? Will it be B, Alzheimer's disease? Would it be C, rheumatoid arthritis? Or would it be D, congestive heart failure? Yep. Welcome to Friday, Wednesday Night Live, everybody. All right, revealing the answer in three, two, and yes, yes, yes. So many correct answers. It is D. Congestive heart failure, CHF, often leads to fluid retention. So clients with CHF typically require fluid restrictions, and that's going to help to prevent fluid overload. So I think about 30 of you all got that answer correct. Great job. Question two. When caring for a resident with a catheter, what is essential for preventing urinary tract infections? Is it A, empty the drainage bag once a day? B, change the catheter weekly? C, keep the drainage bag below the level of the bladder? Or D, keep the drainage bag above the level of the bladder? Hopefully, this won't slow down the stream. But I'm so proud of you. So many of you all chose C. And if you chose C, you are absolutely correct. That's right. So we're going to keep the drainage bag below the level of the bladder because doing so helps prevent the backflow of urine and reduces the risk of infection. Question number three. A resident with dementia refuses to take a bath, saying, I already bathed today. How would you respond? A, insist that the resident takes a bath now. B, skip the bath and document their refusal. C, calmly explain that it is time for their bath and offer reassurance. Or D, ask another CNA to help convince the resident. What do you think, team? All right. I think I saw some A's, B's. We have a lot of C's. And you all, when you take your CNA examination, I'm going to try to remind you in every video, you can request an oral examination. That's right. You can have the test questions and answers read to you via computer. So if you're having a hard time with maybe terminology or if English is your second language, go ahead and ask for that oral test instead. And question three, you all knew the answer. It's going to be C. Residents with dementia may resist care due to confusion or fear. So you're going to offer reassurance and a calm explanation, and that's going to help build trust and cooperation. All right, question four is a patient with a tracheostomy. So a resident with a tracheostomy tube has thick mucus blocking the airway. You're a CNA. What should you do? Is it A, remove the inner cannula, B, notify the nurse and stay with the resident, C, change the tracheostomy dressing, or D, tell the resident to cough forcefully? And that's really scary. You're in a room, and this person with a tracheostomy, they're having a hard time breathing. I usually joke and say above your pay grade. This would definitely be above your pay grade. You stay with that resident, but you're going to do B. You're calling that nurse because as a CNA, you're not authorized to remove the inner cannula. And so you're going to have to get that nurse in there. She's going to have to suction. She may have to remove that inner cannula, but she knows those advanced techniques to do. Your job is to report it and to stay with that resident. Question number five. While assisting a resident with dressing, you notice redness and a small blister on their heel. The nurse is currently occupied with a patient during a procedure. What should you do? A, notify the nurse immediately, even during the procedure. B, apply a bandage to the area. C, document the observation and proceed with the dressing. D, elevate the heel and notify the nurse as soon as she is available. All right, looks like we have A's, we have B's. All right, I see a lot of correct responses coming through. Yes, this is not an emergency. So it's going to be D. What you can do in the interim is you can just elevate that heel. Redness and blisters are early signs of a pressure injury. So, yes, you have to tell the nurse, but you can't go and interrupt her procedure that she's doing on another patient. So, while it's important to notify the nurse, it's equally crucial to avoid interrupting a nurse during a procedure unless it's an emergency. So, what you'll do in the interim is elevate the heel to reduce the pressure. And as soon as you see that nurse, that's when you will let him or her be made aware. Question number six. When assisting a resident with dressing, what should the CNA do first? Is it A, ask the resident to choose their clothes? B, put on the patient's socks? C, assist the patient with putting on their pants? Or D, button the patient's shirt? I love this. It's a lot of A's, a lot of B's. We're torn. We'll wait for five more responses. And looks like we have them. Yes, everybody. So remember when you're taking your CNA examination, you have to include the patient in their care. So that's why you knock, you introduce yourself, you let them know what procedure you're going to be doing, you get their permission. And then before you start dressing them, you're going to let them pick their clothes. So it is A, allowing the patient to choose their clothes promotes autonomy and respect for preferences. Number seven, a resident has difficulty swallowing and begins coughing while drinking water. What is your priority? Is it A, encourage them to eat some bread? B, hit them in the middle of the back repeatedly? C, stop offering water and notify the nurse? Or D, offer solid food instead? Yeah, this one's super easy because I know you all are great at patient care. And if you see something that's causing harm to a patient, you're going to stop them from doing it. So, no, you're not going to hit them in the back repeatedly. You're going to stop giving them that water. It is going to be C. And then you can encourage them to cough. So, difficulty swallowing and coughing while drinking water could indicate dysphagia or an aspiration risk, which may lead to choking or pneumonia if not addressed immediately. The priority is to stop offering the water to prevent further complications and to notify the nurse. Offering food or other liquids without proper evaluation could worsen the issue, and hitting the resident in the back is not recommended. I don't care what you saw your grandmama do. Do not hit people in the back when they're coughing because you're actually going to make that fluid, whatever's in their airway, you can make it go further down and they can end up getting aspiration pneumonia. So if they can't cough it up, don't hit them in the back and make it dislodge or go down further. Question 8. A resident with a history of wandering is not in their room or common area. Uh-oh. What should you do first? Is it A, ask another CNA if they've seen a resident? B, search nearby areas systematically? B, search nearby areas systematically. C, ask other staff members to check the building exits. Or D, notify the nurse immediately. Yep. And there was a patient who, during shift change and the facility was understaffed, that patient went outside in one of the northern states and that patient froze to death. So if you can't find your patient, I don't care how short staffed you are, it is D. We need to go ahead and call a code yellow, whatever the color the code is at your facility. We need to lock down those doors. Don't forget, and then security is going to get involved. And yes, you may have to call the police if you cannot find your resident. But notifying the nurse initiates the facility's protocol for locating a wandering resident and ensures a coordinated response. Your job as a CNA or a PCT is to always know where your patients are. And maybe your patient went to a test. You won't know if you don't communicate with your nurse. So communication is important. Question 9. What is the correct way to perform nail care for a diabetic patient? A, file the nail edges with a nail file. B, soak the feet in hot water before trimming. C, use fingernail clippers to cut nails. Or D, trim the nails very short. All right, I see Lois has A and Julia has A. Miss Grandy, Danita, Farah, Sadana. Yes, yes. So you all remember as a CNA, you don't clip. All you can do is file. And when it comes down to toes, that's above your pay grade. That's a podiatrist. Even I, as a nurse, do not clip or file toenails. I'm going to consult the primary, who's going to consult a specialist. So filing the nails, we're talking about fingernails, helps to prevent jagged nails and injuries, which are particularly important for diabetic patients. And it's a reminder, nursing assistants are not allowed to clip nails. And if it's something involving the feet and the foot and the nails on the feet, we have specialized doctors for that. Number 10. A resident with a feeding tube appears restless, complains of nausea, and has an elevated respiratory rate. What could these symptoms indicate? Would it be A, the resident is experiencing anxiety? B, the feeding tube may be causing complications? C, the resident is dehydrated and need water? Or D, the resident is adjusting to the feeding routine? Restless, nauseous, and tachypnea. That's right. Our CNAs are absolutely phenomenal because you understand that it is B. That tube feeding, that feeding that's going through could be causing your patient problems. So all of those symptoms are are signs of potential distress and could indicate complications. Maybe the tube's not in the proper position. Maybe the patient isn't tolerating the feeding. Sometimes they don't digest that the food well, even though it's liquid. So your job would be to, of course, notify that nurse. And we usually keep a patient who's on a tube feeding. We don't have them in 90 degrees. We don't have them in like high fowlers because that can cause pressure injuries to their sacrum area. So they're usually about 30 to 45 degrees. We have them in a semi reclining position, or we can call it semi fowlers. So make sure they're positioned correctly also. All right, let's go to our next one. Number 11. A resident complains of pain and swelling in their calf, and the leg feels warm to touch. What might this indicate? Is it A, muscle cramp, B, deep vein thrombosis or DVT, C, peripheral neuropathy, or D, they need to eat a banana? In other words, they have an electrolyte imbalance. Their potassium is low. When I tell you, you all are so smart. Oh my God, if you're already, some of you all might as well go ahead and register for nursing school because you all know these answers. So, yes, it is B, deep vein thrombosis. So, pain, swelling, and warmth in the calf are symptoms of a potential blood clot. You don't move that patient, you keep them in that position. And of course, you recognizing what's happening is what is really important because you are the nurse's right hand. When you see something wrong, you notify the nurse. You see that calf is warm and it's painful, have that patient remain in the bed and get your nurse into the room. Question number 12. A resident complains of frequent urination, excessive thirst, and unexplained weight loss. Which body system might be affected? Is it the respiratory system, digestive system, endocrine system, or nervous system? I see B's, I see C's, I see a D. So we're all around the alphabet on this one. Danita, V is not an option. So everybody who chose C, endocrine system, you're absolutely correct because that is the system that regulates the hormones. And so this could be a symptom of uncontrolled diabetes, a disorder of the endocrine system. And so with those symptoms, that usually means their blood sugars are high. And that's of course, and this could be a new admit. You don't know this person. They just came in and they're like, hey, yeah, I've just been urinating a lot. I'm always thirsty and I've lost 5 pounds. You're like, huh, huh, let me go tell the nurse. All right, so notify the nurse for proper evaluation and management. 13, which of the following terms means abnormal enlargement of the liver? Is it hepatitis, megaliver, hepatomegaly, or gastritis? You have to know your prefixes and your suffixes. The prefix would be the term that goes before the key term, and then your suffix will be the term that goes after your key term. So it would not be hey, A, hepatitis is inflammation of the liver. It wouldn't be B because I made that word up. So, yes, everybody, it is C, hepatomegaly. And so that refers to the abnormal enlargement of the liver. So, hepat would be liver, megaly, think mega, would be an abnormal enlargement. Let's go to our next question. Question 14. A resident is experiencing muscle weakness, confusion, and irregular heartbeat. What might this indicate? Is it A, dehydration, B, electrolyte imbalance, C, anxiety attack, or D, low blood pressure? And I know you're thinking, why, as a CNA, do you have to learn about medical conditions? Because sometimes you work in home care and you are the only person who, besides the nurse who comes out once a week, who sees that patient on a daily basis. And so you have to recognize some of these signs and symptoms, and you have to know when to notify the nurse. So if your patient is experiencing muscle weakness, confusion, and an irregular heartbeat, it might not just be dehydration. It could be an electrolyte imbalance. That is right, baby. When those electrolytes get off, your patients go wonky. So, muscle weakness, confusion, and irregular heartbeats are all signs of electrolyte imbalances, such as a low potassium. This requires prompt attention from the nurse. So, you're in that house, something's not right. Your facility will let you know whether or not you need to call 911 first, or if it's, just something minor, you would call that nurse first. But that means that that nurse needs to make that patient a priority and come on out and draw some labs. Question 15. A resident has a flushed face, rapid breathing, and complains of a pounding headache after eating salty food. Which body system is likely affected? Is it A, the digestive system, B, the immune system, C, the cardiovascular system, or D, the respiratory system? And I'll give you a few seconds for this one. And that is correct, you all. Come on. Pounding headache, flushed face, their blood pressure is high. It is C. It is the cardiovascular system. So these symptoms may indicate high blood pressure or hypertension, especially following high sodium intake. Reporting these symptoms to the nurse is essential. And when you're taking your CNA test, there's not going to be a lot of questions where the correct answer is going to be, tell the nurse. So, as far as your CNA exam is concerned, if there is a change in your patient's condition, the answer is notify the nurse. But outside of that, the test is geared to see what you know. How will you be providing this care? So even though as we're going through this, I give you the correct answer, but then I tell you what the next step would be to contact the nurse. Don't expect a whole bunch of answers on your test to be that way. It's usually going to be what would you do? Okay, so let's go to our next question. All right, a CNA records a resident's blood pressure as 160 over 90, and the mmHg stands for millimeters of mercury. Does not report it to the nurse. What type of medical error does this represent? Is it A, a communication error, B, a documentation error, C, negligence, or D, equipment malfunction? Blood pressure is 160 over 90, and you didn't tell anybody. Hmm, that is your hint. You didn't tell anybody. That's right, Zilma. There you go. If I can get to you, we got so many people. So, Zilma, you have it. That's right. You're the first one, you all. That is a communication error. All right. So, it's not necessarily negligence because you forgot to report it, but failing to report abnormal blood pressure readings to the nurse is a communication error. So, I need for you to timely report things that are outside of the normal. So, when you're going around, you're getting your full set of vital signs, you may have 10 patients that you're doing vital signs on. And if 9 of those 10 patients had normal vital signs, you would not come out of the room and tell me those 9 patients' vital signs. But when you get to that 10th patient, if something is abnormal, you're going to come and let me know right then. So that would prevent a communication error. You let the nurse know, hey, the blood pressure is 160 over 90, the heart rate is 110. And then after you verbally let him or her know, you need to go back and document that you have also reported it. That way, there won't be any communication errors, and he or she cannot say that you never told them. And don't forget to go back and check on your patients. All right. We do work as a team, but sometimes your nurses are not, some nurses need more motivation than others. That's what I'll say. Pray for them. All right. Question 17. A CNA notes a resident's temperature as 101.5 and delays notifying the nurse for 3 hours. What is the risk of this error? A, the resident may feel uncomfortable. B, it could lead to dehydration. C, the resident's condition could worsen, leading to sepsis. Or D, it may cause a medication dosage error. All right. And we know that if you don't report it, it's going to delay care. So it's going to be C. A temperature of a 101.5 degrees Fahrenheit is a sign of potential infection, and that infection can enter the bloodstream. That's what we refer to as sepsis. So delayed reporting may allow the condition to progress, increasing the risk of severe complications like sepsis. 18. A resident has a heart rate of 45 beats per minute and feels dizzy. What does this most likely indicate? Is it A, a normal variation for the resident, B, bradycardia, C, anxiety attack, or D, mild dehydration? Let's see if you know your medical terms, your medical conditions. Oh, I'm so proud of you all. So many of you all chose B. Oh my God. Y'all know how to make this nurse smile. Oh, I'm so proud of you. Yes, it is B, bradycardia. And because our heart rate is so close to zero, 45 to me is pretty close to zero. Look, that requires urgent attention. So that is abnormally low. Remember, the normal range is from 60 up to 100 beats per minute. And anything less than 60, you're notifying your nurse. Anything greater than 100, unless you've been told otherwise, you're notifying your nurse about that too. And so whenever the heart rate's low, that means the cardiac output is low. There's no blood circulating. So that's going to lead to inadequate circulation. And so do not get that patient out of the bed, leave them in the bed, call your nurse, and then go ahead and do your full set of vital signs. If you have all the equipment, when the nurse comes into the room, you shouldn't just be telling her, hey, the heart rate's 45. No, you're going to be telling her what the heart rate is, what the blood pressure is, respiratory rate, etc. Try to get everything, but you cannot leave the room to get the equipment. All right, let's go to our next one. 19. If a patient is described as ambulatory, what can be inferred about their condition? Is it A, they require a wheelchair, B, they are bedridden, C, they can walk and move around, or D, they need assistance with standing? Your patient is ambulatory, and that's actually something you want to see. Plan of care says patient is ambulatory. You are happy. Yes, everybody, you're happy because that means that your patient can move around. That is right. You make sure they have their non-slip shoes or their little slippy, their grid socks next to the bed. Make sure they have them on their feet before they get up, because even though they can move around, they still have to be reminded of how to do so safely. So yes, 19 is C. An ambulatory patient can walk and move around with or without assistance. Please check the patient's plan of care to view their activity orders. All right, number 20. Which food items should a CNA encourage for a patient with anemia? Is it going to be white rice, pasta, and applesauce? That was A. Is it going to be B, spinach, red meat, and fortified cereals? Will it be C, orange juice, bananas, and yogurt? Or will it be D, potatoes, white bread, and chicken broth? And the nurse goes, wow, because all of you all know what foods are required for somebody who is iron deficient. So, yes, it is B. Those foods that we mentioned, the spinach, red meat, and fortified cereals, are rich in iron and essential nutrients needed to combat or to prevent anemia. And so, the other ones, they did not have any iron in them, but you all made the right selection. So proud of you. Question 21. You are feeding a patient with dysphagia, excuse me. Which item should not be given to this patient? All right, so DYS in front of a word means difficulty or pain. So this person has difficulty swallowing. Which of these food items will you not give them? Would it be A, food thickener? Would it be B, thick liquids? Would it be C, thin liquids? Or would it be D, mashed potatoes? Someone's having difficulty swallowing. What do you think? I see A's, I see B's, I see C's. And so a lot of your patients who are on aspiration precautions, so as the CNA, you're going to be the one who most likely recognizes that, hey, this patient's having swallowing issues. They're coughing while I am feeding them, and you're going to notify the nurse. Once the nurse comes in and does her evaluation, usually as a nurse, we just go ahead and automatically make the patient NPO. It's like, hey, right now it's not safe for you to eat or drink. Let me contact the doctor. So we're putting them on NPO status and then we're calling the doctor to tell them what we did and why we did it. And then the doctor will usually go ahead and write that NPO order and also order speech therapy. Why am I telling you all this? Because you have to know the whole process. Speech therapy will then do an evaluation, a swallowing evaluation. They may even take them downstairs so they can actually, under fluoroscopy with contrast, see if the patient is aspirating, and they're going to determine what type of thickness their liquids need to be. It could be honey thick, it could be nectar thick, etc. So most of your patients who are on aspiration precautions, they will have food thickener. They will also have um, liquids. Their liquids will be thick also. And then so mashed potatoes will be safe for them to actually eat because it's thicker. What they can't have is thin liquids. Like if you were giving them water, you'd have to put the number of scoops required to make it honey thick or whatever the speech therapist has prescribed. And so that's how that works. If anyone's at risk of aspirating or having food or fluid going into their lungs, they will never be on thin liquids. All right. So sorry, long spiel. I'm long winded. All right. Question 21. You're feeding a patient. Oh, we just did that one. Sorry about that. Let's go here. Question 22. There will not be any true or false questions on your CNA exam. I just wanted to throw them in here to break the monotony. So, true or false, CNAs are allowed to independently decide to use physical restraints on a patient if they believe it is necessary to ensure the resident's safety. Is that true or false? That's right, team. False. No, I can't do that as a nurse. I have to call the doctor. So, yes, you're right. It is false. The use of physical restraints must be authorized by a physician. So, CNAs are not permitted to make this decision independently, as misuse of restraints can violate residents' rights and lead to legal issues. So, you will help me put them on the patient, but only after I got that order. All right. So, question 23. What is the role of teamwork in dealing with difficult patients in a healthcare setting? Is it A, to minimize collaboration to avoid conflicts? B, work independently to assert individual authority? C, collaborate with colleagues to develop effective strategies? Or D, compete with colleagues to gain recognition? And now we know we have to work as a team. So even if you don't get along with somebody, try to get along with them well enough to take care of your patients. So we have to do C. We have to collaborate. We have to work together because if you don't get along with Nancy, but you need Nancy to help you turn the patient, well, guess what? That patient's not going to get turned. So collaborate, work with your colleagues. It's essential to develop those effective strategies to provide comprehensive care to your patients. Question 24. What is a critical consideration when assisting a patient with eating? A, encouraging the patient to feed themselves. B, check for dietary restrictions and allergies. C, feed the patient as fast as possible. D, only provide liquids. Critical. Which of these are critical? Right, we have A's and we have B's, but we have way more B's than A's. That's right. It is critical when your patients receive their trays. Look, you are Johnny or Johnetta on the spot. You take that lid off. You have to know what allergies your patients have. You have to know what diet requirements they have. Do they have a kosher diet, etc.? Because if it's something on that plate that's going to cause an allergic reaction, you have to catch it. We do not depend on dietary because this patient could have been delivered the wrong tray. So, checking for dietary restrictions and allergies is essential to prevent adverse reactions and to ensure the patient's safety. And then, question 25 is true or false. CNAs can use their personal smartphones to look up medical terminology during their shift to better understand a resident's condition. Would that be true or false? All right, we're revealing the correct answer in three, two, and that is right. Chemo, Sandy, Jax Plays, Nadaj, Jerlene, Rich, Sheila, Zilma. Yes, it's false. I know you want to use your cell phones, but absolutely not, because you could be actually putting information about your patient out there. So that could be a breach of confidentiality. And so using personal devices during a shift can violate facility policies, compromise professionalism, and risk exposing protected health information or PHI. CNA should use approved resources. It's called the intranet. Your hospital has a computer and an intranet, an internal web of resources that is safe for you to use and do your research. So that's what you're going to use instead. You cannot use your phone to research your patient's conditions. And guess what, team? You know I love you and I appreciate you. And remember that you're doing this the right way. You're starting off as a CNA and then you're going up to whether it's LPN or RN, or maybe you don't want to do that at all. Maybe you're pre-med. Maybe you're just getting your CNA license so you can be working in the hospital, getting those clinical hours so you can become our future doctor. So I love you. I appreciate you. And thank you all for tuning in. You all can go to nurseeunice.com to download our free resources. And now stick around for a few moments in the chat to see what questions you have. All right, everybody, great job. I'm so proud of you. Oh, Rich, you're welcome. And Jack's Play, you're welcome also. And I know some of you all had specialized videos that you wanted. We get a new set of interns mid-September. So yes, we'll be able to crank out more videos in September. Oh, you all are a blessing to me, and I just want to make sure that, I'm here to support you in your journey, all right? Because one of you all may, or a lot of you, could be the future Nurse Eunice, and I'm a lot older than you all. So, hey, I'm gonna need someone to take care of me, and I know as long as you all around, I feel that the future of healthcare is in good hands. All right, so if you all don't have any questions, Nurse Eunice is about to go to sleep. All right, you all, I love you. Good night. And good luck on your test, Rich.